Good afternoon. Once again, I'm able to announce that there are no additional positive cases of COVID-19 for Prince Edward Island. Prince Edward Island has had a total of 26 cases and 24 are now considered recovered. But we also need to put this in perspective with what is going on across the world and across the country. Around the world, there have been more than 2.5 million cases of COVID-19 and more than 178,000 deaths. And across Canada, there have been more than 38,000 cases and more than 1,800 deaths. And to give a sense of where we are in terms of our rate of cases per 100,000 people, and it varies across the country. Our rate of cases per 100,000 is 19 per 100,000 in PEI. And in Nova Scotia, the rate is 76 per 100,000 and going up to, in Quebec, 275 cases per 100,000. When we look from the beginning of this pandemic in the country till now, 78% of the cases across the country have been due to community spread and community transmission, and the remaining related to travel. And overall, the cases in the country, 18% have been hospitalized and 4.7% of the cases have ended up in the ICU. Although we have started discussions on gradual ease back restrictions and the Reopening Pei together, I may need to continue to clarify what this means, and we'll be having ongoing discussions together over the weeks ahead. Our ease back, our Reopening Pei together will be a delicate balance between relaxing public health measures that have been put in place, but doing so in a very cautious manner. And although we relax in one sense, we're also making sure we have really ongoing tight measures at our borders into Prince Edward Island, and of course with long-term care facilities really wanting to protect our vulnerable populations and not wanting to overwhelm our health system. We need to continue doing a lot of what we have been doing and doing so well at. Self-isolation following return from travel outside the province, staying home as much as possible, practicing physical distancing when we need to go out, and good hand washing, of course. And we've been going over these measures for a number of weeks now, but we do need to continue those, and it will be absolutely key even as we go forward in terms of easing back some of these measures. In terms of testing on Prince Edward Island, we've done more than 2,500 tests. We have 109 tests that are pending, and I expect those will be largely done today. The testing is a really important part as we talk about easing up restrictions from a public health measures point of view. It's absolutely critical. We have good testing available, and I'm so pleased that we are in a position that we have capacity to do testing here locally. I'd like to remind people that we are testing and encouraging anyone who has symptoms, whether or not they've had travel, to be tested. Healthcare workers with any symptoms should be tested. We are testing those who are admitted to long-term care for COVID-19, contacts of cases of COVID-19, of course, and we'll also be testing temporary foreign workers. I have a meeting later on today to look at finalizing the criteria for expansion of testing in terms of the criteria, and we'll be continuing to have that discussion, and we will keep you updated. I've had questions as well about the Operation Isolation, which is also another component of our response to COVID-19. So since the end of March, there have been 2,593 people who've been followed as part of that Operation Isolation, where we've been contacting people after their arrival and phoning them every day for that period of self-isolation. Currently, there's 1,585 people who are in self-isolation, so we're making over 1,500 calls a day to that group of people. Also getting questions in terms of our border screening. So again, since the end of March, there have been 1,407 vehicles and 1,758 individuals who have been screened at our airport and our bridge. And people have asked, well, why are people coming into Prince Edward Island? And for instance, we have new people who are beginning that self-isolation process today, and who would they be? And so some people may be permanent residents who are coming back to Prince Edward Island. Some of them may be university students who are returned home. Some people may be a locum who's doing as a physician who may be working here. And of course, some people also traveling back and forth for medical appointments, and they would also be captured at times when they come back and forth across the bridge. We are in a state of emergency for the province and in a public health state of emergency, and so lots of questions about essential travel. I know in the last number of days, the Emergency Measures Organization has received over 2,000 emails and phone messages regarding travel to the province. As the weather gets nicer and summer gets closer, we certainly normally would see an increase in visitors to our island. I would like to remind anyone wanting to travel to PI that it is not the time to come for non-essential reasons. And you really should be coming for essential reasons only. And it's a reminder as well that if you're coming to perform essential work on Prince Edward Island and it is essential, you should have documentation for this. And it's important that essential workers self-isolate when they are not at work for that period of 2 weeks when they arrive. I know there are also compassionate reasons. You are wanting to come to Prince Edward Island, and absolutely these are being looked at, and we want you to come, and there's a variety of reasons for compassionate reasons. I've also received a number of questions about mass gatherings and restrictions on mass gatherings. And I'm not going to put a date on when we lift these restrictions, but I can say that restrictions on mass gatherings will remain in place for the foreseeable future. Now, the definition of a mass gathering may change over time, and we will continue to have that discussion as we go through the weeks ahead. Right now in Prince Edward Island, and similar to Nova Scotia, any more than 5 people who aren't members of your household is considered a mass gathering. Of course, there are exceptions if you're in a place where health and social services are being delivered. I was also asked just to mention that new long-term care guidelines are available on the website, or should be going up on the website momentarily. I was asked yesterday about the seafood processing guidelines for temporary foreign workers, and they also were sent for to be put up on the website. After the announcement this morning, we'll continue to work with lobster fishers and the industry around vessels and the processing plants to try to keep everyone safe when that time happens. In the last few weeks, we have learned a great deal about who's at risk in terms of COVID-19, how the disease is spread, and how we can protect those who are most vulnerable. And in many ways, that's why we are able to start talking about easing up. There are plans that have been put in place at our facilities at Health PI, for instance. We have an ability to identify, test, isolate, and do contact follow-up of cases and the contacts. So a lot has happened in a number of weeks, and we have learned. But I think I said this yesterday too, there's no guidebook that's already available for a COVID-19 pandemic, because we've never had a COVID-19 pandemic before. But we have learned a great deal, and we'll continue to learn a great deal as we go forward. We'll learn from each other, we'll learn from other provinces, and we're learning from what has happened across the world. In the last number of weeks, we've shifted our lives, work, home, our social lives to accommodate the various public health measures we've put in place. And it hasn't been easy. But we've seen that it has made a difference, and we want to continue to see that it makes a difference in the weeks ahead. As we continue to follow the measures and look at what Reopen Pei together looks like, we need to make sure we do so gradually, thoughtfully, and safely, so that we can get back to the things that we love and miss. This isn't over yet, but it won't last forever. So let us be calm, let us be kind, let us be patient, and let us look after one another. Thank you. Okay, quelques mots en français avant Marion. Il n'y a toujours pas de cas positifs à l'île. On a un autre cas rétabli, donc c'est maintenant 24 sur 26 des cas sont rétablis. Mais il faut aussi regarder partout au monde et au Canada. Autour du monde, nous entendons le chiffre de COVID-19 augmenter. Il y a maintenant 2,5 millions de cas de COVID-19 et 168 000 cas décès. Au Canada, il y a plus de 38 000 cas de COVID-19 et plus de 1 800 morts. Hier, on a commencé à vous parler de relâchement, mais il est important de noter que ce n'est pas aujourd'hui. Mais dans les jours qui suivent et le lendemain demain et le lendemain, nous parlerons toujours des directives qu'on doit continuer pour qu'on puisse envisager un relâchement. Ça fait des semaines qu'on en parle et que je vous demande de respecter ces consignes. Et c'est parce que c'est important de continuer ces actions. Comme je vous ai dit, ça va être un équilibre très délicat entre relâcher les consignes tranquillement et le besoin de continuer de protéger notre population vulnérable et d'assurer la capacité de notre système de santé. On réalise des tests pour les gens qui présentent des symptômes de COVID-19 depuis des semaines, peu importe s'ils ont voyagé ou pas, et j'encourage tout le monde avec les symptômes d'être testés. Et on va continuer à faire ceci pour planifier notre plan de relâchement. Et je vais assister à une réunion plus tard dans la journée sur comment on va améliorer notre capacité des tests internes. Je sais que c'est normalement le temps qu'on commence à voir des visiteurs arriver à l'île, mais comme je vous ai dit maintenant, ce n'est pas le temps de venir pour des raisons non essentielles. Je vais mentionner que l'Organisation des mesures d'urgence a reçu plus de 2100 courriels et de messages quant au voyage. Il y a beaucoup de questions sur les rassemblements et les événements qui auront lieu ici dans les prochaines semaines et mois. Je n'ai pas une date précise pour le moment, mais je sais que ce ne serait pas parmi les premières choses à relâcher. Nous avons effectivement changé la façon que nous vivons avec les directives qui nous protègent du COVID-19. Et ça n'a pas été facile, ça ne l'est pas toujours, mais ça fait une différence. Nous pouvons le constater avec nos chiffres. Quand nous envisageons le relâchement tranquille des consignes pour retourner aux choses qu'on aime faire, qui nous manque, on doit toujours retenir que c'est seulement possible si on continue de faire ce qu'il est nécessaire. Il n'y a pas de manuel, et j'ai dit même chose hier, pour nous dire comment passer à travers cette pandémie. On le fait ensemble pour la première fois et on s'adapte au fur et à mesure que les choses changent. Je vous remercie toutes de votre patience, de votre collaboration et n'oublions, ce n'est pas pour toujours. Ça va bien aller tant que nous restons calmes et respectueux. Merci.
Good afternoon, everyone. As Dr. Morrison has said, it's with our collective good work as a province in keeping COVID-19 at bay that we're now able to begin planning for a gradual reintroduction of some health care services. And this would be in addition to the essential services that we've been offering for the past number of weeks. This process requires a high level of communication and coordination between clinical teams, health PEI leaders, the Chief Public Health Office, and the public. We all want to be back to our normal lives. However, getting there will require a phased approach that moves forward in step with the continued containment of COVID-19 here on PEI. As such, we have a group coming together to coordinate any gradual increase in services. Clinical leadership is taking time to assess what procedures and for which patient types are suited for this early phase of reintroduction. These services will undergo a risk assessment from a public health perspective as well to ensure the safety of our population as a whole. As services begin to increase, there's no need to call and inquire about your status. Please be assured that we will get in touch with you either through your healthcare provider directly or through Health PEI staff if you are being rebooked or reassessed for your services. While considering this ease back of some services, we also have to take into account how additional medical appointments and procedures will affect our capacity to care for Islanders quickly if there is an outbreak. Our plans at this time will continue to keep occupancy levels in the hospitals low, and we know that long-term care is where COVID-19 has hit people the hardest across Canada and around the world. We will consider how additional services or procedures will cause us to use more personal protective equipment and medications that sometimes are in short supply. As we've said, our priority right now is ensuring long-term care homes, and in particular are prepared and have the right equipment to prevent and, if necessary, contain any outbreak. I want to mention the continued offering of some of our health services to ensure Islanders and our communities know what's available to them during this time. On Tuesday, yesterday, a mental health and addictions information service was added to the COVID-19 response line. And any Islander can access this service by calling the 1-833 number that's here in front of me, but it's 1-833-533-9333. And this line provides information on how to access mental health and addictions services. Calls will be answered by a trained mental health and addictions staff member from 8 to 4 Monday to Friday, and your calls will be returned if you leave a message. Individuals with non-urgent mental health and addiction needs will be directed to the appropriate services provided by Community Mental Health, which are still ongoing, and community mental health clinics and walk-in or call-in services are still available. Individuals who have urgent mental health and addictions needs will be directed to our psychiatric urgent care clinics, which are now located both at Hillsborough Hospital and, as of yesterday, at the Prince County Hospital as well. Psychiatrists are available on call via telehealth as required. Clinical psychologists, crisis nurses, social workers, addiction workers, and occupational therapy workers are also available as part of this multidisciplinary team and part of those clinics. A reminder that any individual who requires emergency services should call 911 or visit the emergency department as usual. And other information is available online on the princeedwardisland.ca/COVID-19 site if you look under mental health supports. We do continue to offer our cough and fever clinics and drive-through testing services, both in Charlottetown and Summerside, 7 days a week. On Tuesday, we saw 71 patients at our Charlottetown clinic and 29 in Summerside. Appointments are available at these clinics for anyone with symptoms of COVID-19, and they can be made through calling 811 or through your family doctor or nurse practitioner. I do want to remind people just once again that all islanders that require urgent or emergent care, as well as other essential services, those things are still available to you through Health PEI. Our hospitals are open, our emergency departments are open, and they are safe for you to come and receive care. They have processes in place to screen patients upon entry and make sure that people receive the services that they need. If you have an emergency, please call 911 or visit one of our emergency departments. Thank you.
Thank you, Marion, and happy to take some questions.
Nicole Williams, CBC.
Hi to you both. My first question, I actually believe both of my questions will be for Dr. Morrison. Are there new measures in place at the airport if someone is deemed to be a non-essential traveler?
So that has been an area that I know we've talked about here, and it has been a challenge. So we haven't had as many people coming through the airport lately, and it hasn't happened in the last number of days. But there is a measure in place so that if someone comes by air and is deemed to be non-essential, then they could be put in a facility for the day that it takes to get another flight back out of Charlottetown, because just with the frequency of flights, they may have to wait at least a day to leave. Now that hasn't happened at this stage, but it is a possibility if needed.
A follow-up to that. So you said they're put in a facility. Mm-hmm. Where exactly, like what kind of facility are they put in? And who pays for the plane ticket back?
So it would be a hotel that would be nearby, and so I think it would be in Charlottetown. And in terms of who would pay for the flight back, I'm not sure, but I'm sure we'll get that question and figure out the details because it hasn't happened yet. I'm not exactly sure, but certainly at the bridge they do turn around, and I'm hoping that it doesn't happen, of course. And this state of emergency is for a defined period of time, but certainly it's important that we look at why people are coming. And I've always said that the other big part of this is that isolation, the self-isolation, no matter who comes for what reason. But I don't know, Nicole, in terms of who would be paying for that flight back, but I'm sure we'll figure that out.
Thank you.
Mm-hmm.
Louise Martin, CBC.
Good afternoon to both of you today. Both my questions today are for Marion Dowling. So thanks, Marion. Yesterday you said that an important part of the ease back of public health measures is making sure long-term care facilities, both public and private, have access to PPE. So do long-term care facilities on the island right now have an appropriate level of PPE?
Yes, they do, Louise, that they've received distribution. The private facilities have received it from the provincial government storage facility, and they've been acquiring some personal protective equipment such as masks and gowns and gloves for a number of health services, but including private long-term care. And our public long-term care facilities have also received their allocation of that protective equipment. And we've had a couple of resources going around to visit our long-term care facilities to make sure they know how to acquire additional PPE from our storage, central storage, and to make sure they continue to have it on hand.
So does that, just to clarify, does that include N95 masks as well? Is that...
I would have to check on that specifically, but I believe, yes, it would for things like their emergency carts and things like that. The only time they would be using that would be for what they describe as an aerosol generating procedure. So if they had to do CPR on someone or that kind of thing, had an emergency situation, or be dealing with some of residents who might have tracheostomies that they were caring for, or doing other procedures that aerosolize the sputum of the resident.
Okay, and then I know a while ago the province had put out a call to businesses and organizations for supplies to sort of help the supply to combat COVID-19. Do we have any update on the response to that call out?
I don't specifically. That would have come to the provincial government warehouse, though, where they're storing that and they're supplying it. So I know myself, because some of those responses did come to me, that I forwarded those on, and there was a number of different organizations and groups that responded to that request for support. But I'm sure we could find some information for you on that, Louise, and get back to you on what the response was.
All right, I appreciate that. Thanks to you both. Thank you.
You're welcome.
Sean McDougall, Eastern Graphic.
Good afternoon, everyone. Dr. Morrison, this question is for you. Now that there's guidance for fish plants that employ temporary foreign workers, and with this morning DFO announcing the start date of the lobster season, what specifically is the province going to be doing to monitor public health guidelines for fishing crews and fishing wharves around the island?
So thank you for the question. We have actually, our office has been working already and will continue to work in finalizing guidelines for on vessel and with processing for in the industries with the lobster fishers and the industries. So that work has already started with the Department of Fisheries and that association. So that will continue and over the days ahead. So that will be an ongoing relationship and discussion.
Okay, so when can fishermen and fishing crews expect to see these guidelines come out?
I think they were some of the last final versions of them were being reviewed today, I think. So I would think certainly by the end of the week.
Okay, thank you.
Okay, you're welcome.
Rachel Collier, Eastern Graphic.
Hello, I have a question for Dr. Morrison again today. And it's given examples of an outbreak of COVID-19 in a food processing plant in Alberta and the closures of seafood processing plants in Quebec and in the U.S. I'm wondering if the idea of opening seafood processing plants in PEI is concerning from a public health perspective. And I'm just wondering, in Prince Edward Island, do you think we face comparable risk given our low number of cases at this time?
So I think anytime you have a large group of people working in one facility, I think you do have potential for increasing that risk. And that's why we're working on guidance to try to minimize that risk and keep people safe. I do think that the fact that we haven't seen the widespread community transmission they have in other places is cautiously reassuring, but it remains, of course, a concern. And just for some of our other vulnerable groups, when you see the devastating, tragic outbreaks in other places and the impacts they have, we will continue to need to be very, very careful, and but recognizing that certainly there are important in our food supply chain in these cases. But I remain always concerned, but trying to make sure we have the really good guidance in place. And and again, just the lower numbers of cases here is good, but we need to continue to monitor and be very careful.
Thanks for that. And I guess the second question or follow-up is, it's been reported that employees in the meat processing plant in Alberta have accused the company of ignoring physical distance protocols and trying to lure them back in to work from self-isolation. So I'm wondering, should the province here in PEI receive any similar complaint from any workers, what actions would be taken to correct the situation?
They would be followed up as part of our complaint process with the environmental health officers in our office. And those would be taken very seriously. And if enforcement needed to get involved, they would do so with our involvement.
Okay, thank you.
You're welcome.
Carrie Wynn McLeod, Ocean 100.
Good afternoon, ladies. Dr. Morrison, you had mentioned just about the expansion of testing. You were having a meeting about that today, and all the variables as to who would be tested. You did mention today, though, that the temporary foreign workers about being tested. Is that simply because they have traveled and to get to the island?
Yes, we had looked at that group in terms of increased risk because they're coming in from outside the country, and they would be also, even at the end of their period of self-isolation, maybe going to other accommodations where they live, a number of people in certainly they're not all in rooms by themselves, and so we thought that is important and to do, so that will be done while they're in self-isolation here.
Super, thanks.
Okay, you're welcome.
And I know there's a lot to be done before everything is lifted. We're probably a long ways from that, but just looking at some of the measures maybe that might start and those that might be a little later, would some of those be the mass gatherings and the restrictions at the bridge and the airport that would be probably some of the last things that would be lifted?
Yes, so we talk about the ones that would probably be in the place the longest, the mass gatherings, restrictions at the bridge to minimize the risk of importation, visitor restrictions at long-term care. And when we talked about this yesterday, we talk about it, as you mentioned, gradual, thoughtful, spaced out kind of easing up. And some of the first measures to ease up would be around elective surgeries, for instance, so in the health field, and also some of the outdoor activities that we could do, and looking at those first, and then it would be going on to after that, in a stepwise fashion, looking at, for instance, non-essential businesses and making sure that they can come up with plans to still be able to physically distance and how they would operate. So that process is getting finalized, and but really important for the safety of all islanders. We've worked really hard, all of us, to be in this position to be talking about easing up some of these public health measures. So how we do so in the weeks and months ahead, we need to be cautious.
Great, thanks so much.
Thanks, Carwyn.
Allison Jenkins, The Guardian.
Hi, yes. Today, I have a couple of questions about long-term care homes. The new guidelines are out, I see, and I just wanted to ask about the one-home policy that was implemented at some of the private homes by PEI Seniors Homes Group. They took their time and consulted with unions and managed to put down a policy that says staff may only work in one home. They can't go back and forth. But the PEI COVID-19 guideline for long-term care homes says that if there is a case of COVID-19 in a facility, staff who are employed in more than one long-term care facility should not move from a COVID-19 facility to a non-COVID-19 site. Yet the operators are asked to ensure policies and procedures are in place to prevent introduction and control of the spread of COVID-19. Can you elaborate on why the provincial homes haven't decided on a one-home policy? It just seems chancy to leave it to the should not move if there's an outbreak.
I think Marion will answer that question.
Sure. Hi. Yeah, we have been looking at that for quite a little while now and trying to establish what the numbers of staff were and really working with the local managers and administrators within our public homes. And I know some of the private homes have taken the policy, as you've mentioned. So what we've been looking at is determining where we can limit the movement of staff within homes and still maintain safe staffing levels within those homes. And we have had the policy for quite some time around any of our staff who've worked in a place, if we had hospitalizations, for example, and if we had staff who worked on that unit with positive COVID patients and they also worked in a long-term care home, they would not have been working within a long-term care home if they were working with positive COVID patients. So we are just looking at it. We do have some of the numbers now, and our Human Resource Department has been talking with our 4 unions that we have within the long-term care facility homes with a variety of staff, and that's everyone from our maintenance staff who support maybe multiple facilities, as well as our direct care staff in the homes, to look at what the impact would be and how we could limit that movement. But our plans at this point are really supporting the protections of having those direct care staff wear masks and have those protective measures of bringing things into the homes so that we can limit any possible exposure that way. Also, we have taken the step for our staff to, with Dr. Morrison's recent changes of looking at anyone who does work in long-term care homes and has traveled out of province is no longer able to come to work in a long-term care home if they've traveled out of province. So they must self-isolate and no longer have an exception to be able to come to work. So we've really put a number of other measures in place, and we are still looking at limiting the movement of staff within a home, because in our facilities there are a number of households within one of our long-term care facilities. So we've been looking at limiting that through staff scheduling, but also having to maintain the staffing levels within those homes.
Okay, so how many or what percentage of staff in the PEI-run homes are in this position? Like, how many people does this affect that are working in more than one home?
Well, we have approximately 1,000 employees who work, and that includes nursing staff and non-nursing staff positions or direct care positions that work across our Health PEI long-term care facilities. Out of that 1,000 staff, we only have just over 80 who work between 2 or more long-term care facilities when we've looked at our data from the last several months of where staff have been working. But we have a number of other staff who work within long-term care homes who also work in other service areas. So they may work in community hospitals or with home care or other services. So that's the numbers that we're looking at.
Okay, so just to clarify...
Thank you, Kevin Bissett, Canadian Press.
Yes, good afternoon. Just a couple of quick questions regarding the plans for reopening PEI. You talk about perhaps allowing some outdoor activities to take place starting in early May. What kind of activities are you talking about, and would that include the provincial and national parks?
Yeah, so hi. Our provincial parks have not ever been closed, so that it wouldn't be changing the restriction in terms of the provincial parks here, but it would be looking at some of those activities that can be done outside and with minimal risk and being able to maintain the social distancing. I think the example we used yesterday, and this would be, of course, working with the Department of Fisheries and the Department of Environment, the angling and the recreational fishing would be one of those types of activities, and certainly has created a great deal of interest here in Prince Edward Island, because this is a season for recreational fishing. So that would be one, and but all of these types of activities would go through a risk assessment, and we won't be able to open up everything all at once, but trying to do so in at least 2-week increments, and that also gives a period of time to make sure that we're monitoring what is happening in Prince Edward Island from a testing point of view in between. So it would be around elective surgeries and outdoor activities are the two areas we would focus on for a week or so from now in early May.
And I wonder if you could comment, if you have an idea, sort of a handle on what kind of backlog there is right now for elective surgeries.
It may be something Marion can answer better from a health PI perspective, but I'll leave that.
Yeah, hi. We're just making sure that we have the information correct. So those clinical leadership groups are really right now looking at making sure we've evaluated. We're in the end of our second, third week period of offering essential services. So the first 3 weeks they have done that, and we've continued to do things like cancer surgeries and any urgent or emergent cases as we've gone forward. And so some of those cases who may have been deferred for the first 3 weeks may have then had their surgery in this last 3 weeks of restrictions. So really looking at all of those cases at this point in time to make sure they're prioritized with the clinical view, the surgeons and the specialty surgeons looking at their cases and their patients to identify which patients need to have their surgery based on that individual patient's need, as well as balancing that with our ability to continue to manage the response if necessary. So I don't have the specific numbers for you right with me today, but we could probably get you something if you need it.
All right, thank you.
You're welcome.
Dr. Antigo, la voix chrétienne.
Yes, good afternoon. I have a question for you, Ms. Darling. I'm wondering, are you worried about people giving up on treatment and more specifically on vaccine and cancer screening? And did you notice a decrease in the number of cancer testing, for example, since the beginning of the crisis?
That's a good question. I haven't heard concern about people worrying about vaccines and immunizations, but certainly we've deferred some of those services that we'll now be looking at how can we safely re-implement and reintegrate some of those other things within our public health and primary health care settings when those are the areas that have really needed to respond the most and continue to need to respond around the testing and the case follow-up and surveillance and monitoring of the contacts as we go forward. For some of our cancer care services, many of those services are considered as part of our essential services that have continued on. Some of the screening clinics, though, are really what we're looking at going forward as well. So some of those might be procedures or ambulatory care type appointments, PAP screening, some of those other things that have been deferred for this last period of time that we need to look at any of those individuals who've had their appointments rescheduled, what is their impact and how can they also be assessed from the clinical point of view and who needs to come forward first as we reopen some of these services. So that's why I say we have that overall coordination and communication that needs to happen, because it would include the laboratory services who've also been very focused on the COVID-19 response, some patients who are waiting for diagnostic imaging appointments or ultrasound appointments. We know those people have been waiting, and so we do want to get to offering some of those things safely and carefully, and to make sure that we have systems in place to keep the public and the staff safe as we go forward. So I don't know that we've heard people are concerned that they're not having that, but definitely we know when we move to essential services, we've deferred some of those things that we now need to reprioritize those individuals and make sure we get them on the docket as we begin to carefully reopen some of those services.
Thank you.
You're welcome.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. On l'a vu dans d'autres provinces autour de nous, Québec, Nouvelle-Écosse, quand la COVID-19 entre dans un foyer de soins de longue durée, c'est souvent dramatique, il y a souvent des décès. Pouvez-vous me rappeler un peu en français ce qui est fait ici à Lille pour éviter un scénario où on retrouverait la COVID-19 dans un foyer de soins? Quelles sont les mesures qui sont déployées, les tests qui sont faits, les équipements qui sont donnés aux préposés, aux employés pour éviter un scénario comme celui-là ici?
Merci. Alors, je sais que tout le monde s'inquiète à propos des cas de COVID-19 dans ces établissements de long-term care. Il faut qu'on a des restrictions pour les visiteurs qui sont très strictes. Il faut qu'on garde ces restrictions. Je sais que tous les endroits cette semaine ont commencé à recevoir l'équipement pour leur protéger, comme les masques. Aussi, on fait les tests pour les admissions avant qu'ils arrivent, et ils répètent ces tests 7 jours plus tard. On était en train de discuter de les personnes qui travaillent, comme les infirmières, lesquelles on doit tester en une base régulière. Et puis, on va discuter ça plus tard cet après-midi. On sait que les personnes qui travaillent à ces endroits, s'ils sortent hors du province, ils n'ont pas le droit de travailler pendant 14 jours. Ils n'ont pas une exception. Et on est en train de discuter comment on va limiter le nombre de personnes qui s'occupent qui travaillent à plus d'un endroit. Alors, je liste un nombre de choses là, mais en effet, c'est un groupe qui est tellement important. Ils sont vulnérables. On voit qu'est-ce qui arrive à Nouvelle-Écosse, Québec, partout au pays. Et puis c'est tragique, et on ne veut pas que ça arrive ici à l'île du Prince-Édouard.
Deuxième question, si je peux me permettre, Dr. Morrison. Oui. Pouvez-vous m'expliquer en français la politique à l'aéroport de Charlottetown si un voyageur non essentiel débarque de l'avion ici, comment il est isolé et comment on le retourne d'où il vient finalement?
Et puis, on n'a pas dû en faire encore, et j'espère qu'on va pas avoir le faire, mais s'ils arrivent et ils sont non essentiels, ils vont être mis à hôtel, par instant motel, jusqu'à temps qu'il peut être mis sur un autre avion pour partir. Et puis, des fois, ça peut peut-être prendre une journée pour s'organiser. Mais c'est là si on a besoin, mais on n'a pas encore, c'était pas nécessaire à ce moment.
Merci.
Okay, merci. Those last questions I've addressed in English already, so I was repeating those in French for those who were wondering. So thank you very much, and we'll talk to you tomorrow.